So before you walk into the room, you want to check physician's orders. Make sure you wash your hands, gather equipment. In this case, we're gonna do nasal suctioning. So you want to do a sterile suctioning catheter with a couple of different NPAs, and then some type of oxygen device just in case they're not already on oxygen. So when you walk in, you want to wash your hands, wear the correct PPE. In this case, we'll wear some gloves. You'll want to introduce yourself, verify it's the correct patient. You'll want to get set of vitals, check SpO2, check her breath sounds, make sure the patient is in a comfortable position, explain what you're gonna do. So if they're already on oxygen, we can increase their FiO2. We'll start by measuring the correct NPA. Once you establish which one you're going to use, then you'll want to lubricate it, and then you'll want to insert it into the nares with the bevel towards the spectrum. You want to twist it motions. You'll notice that once it's fully in, then we'll want to make sure we'll want to put some sterile gloves on. You want to turn on your suction to negative 100 to 120 with 150 max. Once you have your sterile gloves, we'll want to test the suction catheter. Just test it with some sterile water. Once you know it's fully functional, we'll want to keep one hand sterile. So make sure you'll lubricate the tip of the catheter, and this will be inserted in the NPA. You'll want to insert the catheter. You'll want to make sure you notice for any coughing or gagging or change of voice, or have them cough. Once you hit resistance, then you'll turn on the suction, twist in circular motion. Make sure it's no more than 10 seconds with the whole 15 seconds max for the whole event. Once you're done, then you'll want to, if you're going to do it again, make sure this stays sterile, and if you need sputum collection, then you could collect the sputum, and then you'll put it in some sterile water. You'll want to reoxygenate the patient for at least 1 minute before you repeat the procedure. If you're done, then you'll want to, we'll make sure, the other procedure you want to check for any adverse reactions. So there will be continuous monitoring. If there is any, you want to stop the procedure. If there's any laryngospasms, then you'll want to actually leave the catheter in and manually ventilate. Once you're done, then you can put this to the side, make sure you reposition the patient, make sure they're back to their regular FiO2. Make sure you turn off the suction, and then you'll want to make sure the patient is comfortable, safe. You want to gather any extra supplies that you brought in, throw anything away, take your gloves off, wash your hands, chart, let any nurse personnel know anything.